Welcome to the Skelton Report. I'm Mark Nathaniel Skelton, and today we're going to be talking about attention deficit hyperactivity disorder. All right, so let's go ahead get into the presentation. Now, I know myself as a therapist in the past, I've worked with individuals with ADHD, and even currently through my practicum experiences in different capacities. So I thought it'd be interesting to share some information on what ADHD is and what to do about it, because there's a lot of misinformation circulating around about ADHD. So this is just help you get more scientific grounded information on what it is. So let's go ahead and get started. Again, what it is, what are the signs, and what can be done about it. This is what we'll be talking about. Wow. So let's talk about what is ADHD. So ADHD is one of the most common neurodevelopmental, neurobehavioral disorders of childhood. So let me park it here for a little bit. And what we mean by neurodevelopmental means that it begins in childhood. Now, I've had different episodes talking about more so neurocognitive disorders. And again, those are disorders where there's deficit in the cognitive functionings. And I'm thinking more so like associated with dementia, right? For instance, or Alzheimer's. And again, like traumatic brain injuries, TBIs. These generally happen, with adults and older adults. Not all the time, but majority. So that's the dividing line. See, again, TBIs, God forbid, can happen to youth as well. But those other disorders underneath that umbrella of neurocognitive is more so adults. This is more so, ADHD is more neurodevelopmental, meaning it begins more so in the childhood. And there are other disorders underneath this umbrella of neurodevelopmental, such as intellectual disabilities, or if you've heard of like learning disabilities, dyslexia in the sense, or as well as like Tourette's. These are things that begin in childhood. So just keep that in mind as we walk through this. It's sometimes referred to as attention deficit disorder, ADD. That's an older term. And again, usually, as I said, in childhood, but can last into adulthood. This, whether treated or untreated, these symptoms can go on into adulthood. So at the end of the day, ADHD is when children are having trouble paying attention, controlling impulses, or just being overly active. So let's take a closer look at some of the symptoms. All right, so we have a lot going on here, so I'm going to break this down, keep it simple. These are more of the symptoms on this side. There's the inattentive side, and then there's the hyperactivity side, okay? So these symptoms, so you can be ADHD inattentive type, or you can be ADHD hyperactivity impulsivity type, or you can be a combination of both, all right? So I'm going to get into that a little bit, but I just want you to know that these symptoms are what are the criteria to meet ADHD. So over here, again, is that criteria. And the point I'm trying to point out is these symptoms over here need to be present prior to 12 years old. Okay, and again, that goes back to the neurodevelopmental side of things. Next, they need to be present. These symptoms need to be present in more than one or more than two settings. And so what I mean by that is, for instance, you may have inattention and hyperactivity at home, but also that's one setting. But what about that? Is this occurring at school? Because you'll need more than two settings to meet the criteria. All right, so it could continue sports. Does this happen in sports? Does this happen at church? Does this happen at other community organizations that individuals involved in at work? Okay, so it needs to be two or more settings, and also not explained by other medical conditions or mental disorders. For instance, PTSD, post-traumatic stress disorder, has some common symptoms with ADHD. Again, maybe difficulty concentrating or feeling a little hypervigilant, all right? But again, that is due to trauma, all right? Not due to neurodevelopmental elements, okay? So that, again, keep that in mind, neurodevelopmental. So just kind of help separating that out. Now, when we say inattention, that's this type, this leg right here. That's more so individual who may fail to pay close attention, difficulty sustaining attention, easily distracted, and forgetful in daily activities. and the like. Doesn't seem to. Now, we all may do this a little bit, but again, it becomes a disorder when it begins to interfere with how you perform at school, again, at work, or in your social interactions. So this, think more like a spotlight on the stage that just cannot seem to focus where it needs to be during the play. Okay, that's more of the inattentive type. The hyperactivity and impulsivity side of ADHD is more so individuals that fidget, talk excessively, difficulty waiting their turn, interrupting others, on the go, as driven by a motor. And so there's a source from Forbes. I like the way that they worded this. It's like having a Ferrari engine, but your brain only has bicycle brakes. Okay, so that means it's hard to pump the brakes and slow down, all right, in life. That's more of the hyperactive. And again, you can be one or the other or both presentation. All right, so what do we do about it? All right, what can we do? So what we can do is we have therapy, psychotherapy. This is more talk therapy. And you can look at more so, behavioral therapists, CBT. This is where we do behavior modifications and kind of talk through different strategies that can be used in the daily living to manage the symptoms. Another side is medication. Again, this will be prescribed by a physician, maybe generally a developmental pediatrician, but they'll prescribe the medicine to speak to more of the biological and again that neurological side of ADHD. And evaluations this is more of the lane that I'm working and going to school for as a psychologist. And they do evaluations where an individual will come in and we'll do some testing, all right, to see how that performance goes and see if it's if that performance is likely of an individual who has ADHD, and then you can make that diagnosis. Sometimes it depends on the order. Sometimes you could be going to someone here, you're referred here, you get the testing. You get it confirmed as a diagnosis, then you go here to get some medication, or in any order. Okay, at the end of the day, these are treatment options. Okay, and these individuals will more than likely provide a form for you, where since like a parent, if you're a parent, you'll fill it out on your child. Hey, do I see this? Do I see this? And then a teacher also will get the form, and then they'll fill this out and see if they see the same thing. So you get these different lines of sources of information to help tie down and see if it is an ADHD diagnosis. So again, I'm sharing this because these are the different options. This is how you navigate this. Just don't do nothing about it, right? And again, you want to do something about it when it begins to start interfering with academics, social skills, or maybe even work. So keep that in mind. All right, so recap. ADHD, it's a neurodevelopmental disorder. So again, it starts in childhood. Next, there's an inattention side of things, so that difficulty focusing. And there's also that hyperactivity side. All right, so that's just, it's hard to push the brakes on your behavior and your thinking and feeling and all that. So you could have a combination of both. But again, that's just the definition for it to get a better idea of what it actually is. And then there's treatment options. Again, you can do therapy. That's probably be more long-term. I recommend it's a good thing to do while if you're dealing with ADHD. Also, depending on how feelings on medication, med consult is good. And psychologist comes into play as well when it comes to diagnosis. Now, all can diagnose, but again, psychologist works more so on the testing aspect of it. All right. Hope that makes sense. That's where we're at. I hope this information is helpful for you. Do something for me now. Well, we can get some subs going. Grow with me. I'm at the YouTube piece and the Instagram and all that good stuff. If you like this information, get some more there. And either way, thanks for listening. And here goes the resources. Again, APA and the CDC. Great sources on that. All right. And we'll pull it back here. All right, so hey, that's all I got. Hope that was helpful to you as it was for me. Remember, the more that you learn, the more that you earn. And I'll check you out on the next go around. Peace.